recurrent pregnancy loss is a devastating experience, and it is defined as having 2 or more miscarriages before 20 weeks of gestation. After 20 weeks of gestation, it would be considered a stillbirth. So, sometimes a woman can have recurrent miscarriages and there's no apparent reason for them. She's perfectly healthy, and many women like this do go on to conceive a healthy baby. But sometimes recurrent pregnancy loss is a sign of something going on with the fertility health of the mother or the father. And so typically, if you're experiencing recurrent pregnancy loss, the best place to go is a fertility clinic, as they are specialists in this area and they can do really specific tests to figure out what's going on. They don't always find an answer, but you're going to have a much better chance of figuring out what's going on at a fertility clinic than, say, just like going to your OB. So when you're at the fertility clinic, here are a few of the evaluations that they might recommend to figure out what's going on. Okay, so a preconception genetic testing. So genetic testing, it can reveal chromosomal abnormalities or like other genetic conditions that could increase the chance of miscarriage. So that genetic testing can be very informative. A blood test. So blood work helps the doctor assess your reproductive hormones and the health of your immune system. And the test can also reveal if you have any autoantibodies, potential blood clotting complications, pelvic inflammatory disease, or any STDs. These are all things that could increase the chance of a miscarriage. An ultrasound, this lets the doctor assess the health of your uterus and your ovaries. It can provide information about your ovarian reserve and potentially reveal issues like uterine fibroids, polyps, or other uterine challenges that can make it difficult for the embryo to properly implant in the lining of the uterus. An HSG. So this is a non-surgical radiology test that can help the doctor find any potential blockages in the fallopian tubes, in addition to possible uterine abnormalities like intrauterine adhesions, endometrial polyps, or fibroids. And the last thing is a semen analysis, as the quality of the man's sperm can potentially contribute to the recurrent miscarriages. And a lot of fertility doctors will also recommend that the man have preconception genetic testing as well, because maybe he has different genetic issues that could be leading to recurrent miscarriages. Okay, so if you're having those recurrent miscarriages, if these tests reveal what the issue is, okay, great. The doctor can hopefully do something about that. But even if they don't find an answer to why you're having recurrent pregnancy loss, there are still various treatments that can help. So a hysteroscopy. So this is a minimally invasive procedure that allows the doctor to correct uterine issues like fibroids, large polyps, scar tissue, or other fertility challenges that could be contributing to the miscarriages. Okay, the next one is IVF, in vitro fertilization, with PGTA or PGTM. So PGT, this is pre-implantation genetic testing. And having this done on the embryos before the doctor transfers an embryo into the woman's uterus is so helpful, because it can help to ensure that the doctor only transfers a healthy embryo. So the two types of PGT, so there's PGTA, and that's pre-implantation genetic testing for aneuploidy, and PGTM, pre-implantation genetic testing for monogenic single gene defects. So PGTA, it can detect if the embryo is aneuploidy, or essentially has too few or too many chromosomes. This can cause miscarriage, it can lead to failure for the embryo to implant in the uterus, or if the pregnancy does develop, it can result in chromosomal chromosomal abnormalities in the child, like Turner syndrome or Down syndrome. Okay, and then PGTM, it screens embryos for genetic defects involving a single gene, like cystic fibrosis. So this type of PGT would potentially be recommended if the parents had pre-conception genetic testing and they were carriers for certain conditions. Then the embryos might be tested for those particular conditions. Okay, the doctor might also recommend medication for excess blood clotting. If it's been found that you have blood clotting issues, this could be incredibly helpful. I've had a lot of clients who had recurrent pregnancy loss. They got on blood clotting medication and had a healthy pregnancy after that. And yeah, so essentially this medication prevents excess blood clotting in women, especially with certain autoimmune disorders. And then finally, medication for a hormone disorder. So women with thyroid problems, uncontrolled diabetes, elevated prolactin, or other hormonal issues could benefit from various medications the doctor can prescribe. Okay, if you have any questions about this, anything else about fertility, pregnancy, childbirth, early motherhood, let me know in the comments below.